With millions affected by autism,
No visual contact. She wasn't speaking. I didn't know how to help her.
could an experimental treatment be the breakthrough parents have been desperate for?
The second day of treatment were the first words I had heard from my daughter.
And why others aren't so sure.
It hasn't even been submitted to the FDA.
And I think anyone watching our show realizes that every child with autism presents differently, and how you treat them and how they progress, it's different. So on our show, we're always thinking about new possibilities. And I want to introduce everyone to someone in our audience, Dr. Spencer Miller, because Dr. Miller, can you tell us a little bit about a unique treatment that you offer that may have some hope, and certainly for a mom like Leah who feels out of options? And it's called MeRT.
Right.
Can you tell me what that is and how it works?
Yes, so MeRT is an emerging technology. It is experimental in some regards that actually tries to reprogram abnormal electrical signals in the brain. We measure the electrical signals using a quantitative EEG, so it's a very simple, common used practice in neurology, where we put a cap on the head and look at where abnormal signals are coming from. We then turn around with that data and use these electrical signals to send back in the brain and try to attempt to re-attenuate or to modulate these brain signals. And the changes that we measure on these repeated EEGs should correlate to behavioral changes.
And the child looked very comfortable. Didn't look like there was any pain associated with the procedure at all.
Non-invasive, no medication involved with it, no pain. Sometimes you can feel a little bit of an electrical pulse, but it's a mild tap on the forehead.
How many treatments typically do you need to administer, and how soon do you see results, and what have the results been?
Usually within the first couple of days or weeks, you can start to see some benefits, some changes in their behavior. In general, we recommend about 4 weeks to 6 weeks of treatment. The treatments are every day, 30 minutes or so. So they come to the clinic, get the stimulation, and go about their daily business. So some children will have significant behavioral changes very early. Some will take longer to get results. You know, this is all new. And like I said, it's kind of evolving over time.
In your experience, what kind of results are you getting in terms of the number of kids who are showing a benefit, a change in behavior? Do you have a number or percentage?
So I don't have a percentage with me, but for the patients that I have seen changes in behavior, it's typically just exactly what you're asking for. Language in general is one of those things that seems to really be commonly changed. The way that they interact with their environment, their ability to change from, you know, we have to go to a doctor's appointment at 7 today instead of 8, so we're gonna have to change our schedule so there's not a meltdown in your car trying to go to a doctor's appointment. The other thing that we hear a lot of parents talk about is the presence, which, you know, is not really a medical term, but you know what I'm talking about. If your child is not there with you, even though they're sitting right in front of you, you're talking to them, there's just this absence. And so to be able to feel like your child is with you and listening or understanding you, so we hear parents describe those type of behavioral improvements.
And what potential side effects do you discuss with patients when you're talking about this procedure?
So the one that is the most feared really is not that big of a deal. However, we have to discuss it. It's about a 1 in 150,000 chance of having a seizure. It's self-limited. A seizure is abnormal signals of the brain. We're reprogramming the brain, so you can imagine that that's a potential. But the seizure that would occur would be self-limited. You stop the stimulation, the seizure goes away. And I don't know of any cases where treatment has been administered and caused a seizure that then results in epilepsy or the epilepsy syndrome, where you have continuous seizures throughout your life. So I don't know of that to be the case.
I want to open this up to discussion really quickly, because as I'm listening, of course, I'm uninitiated. I've never been around this treatment. I've never seen it administered. But I also will look at Leah and think, wow, sure seems like it's worth a try to me. And that's why I want to ask both you, Lindsay, and also Dr. Miller, how do you go about making that decision? Because what would be the downside to trying it if, as Leah has attested, you know, nothing else has really helped him get to the place you would like him to get to? So I'll open the floor for your comments on that.
So the downside would be no benefit at all the time you would pour into something like this type of a treatment. Again, 6 weeks, 4 to 6 weeks every day. You know, the downside would really be that there is no effect, which we do have children that have gone through 4 to 6 weeks and get no effect or no change in their behavior. What's interesting to note, though, is that we do have research that currently shows that there are specific EEG changes in a autistic brain. And it's not a new tool by any means, but we're starting to understand how, by utilizing EEG to analyze autistic patients, how it can actually help us understand what's going on in the brain. Because we don't know what causes it. You know, we don't really have a cure for it. None of these type of treatments that we're talking about really are FDA approved. They're all off-label. You know, it's important to understand that. However, like you say, there's really no.
Can I ask
Major
two
downside.
questions? How much would it cost, for instance, for a 4 to 6 week treatment
Somewhere
cycle?
around $10,000.
Which
varies,
is,
yeah.
and that's an important question to
varies
ask
per
because
clinic, you know, so.
the cost is always a downside, right?
Absolutely.
If you get no benefit and you pay for something, that's a
Absolutely.
downside.
You feel like a terrible person when you know, after somebody has done that treatment and you're, you know, wow, I appreciate what you've been through, but that's a lot of money to say, hey, sorry, it didn't work, you know.
Dr. Mill, where are we in terms of getting some really good data so that maybe a few years from now we can say this is the treatment protocol and this is what you should do, and if that doesn't work, then this?
I mean, are you gathering data with your treatment of the patients you're doing?
We keep a data set. You know, every single day that the patients come in, the parents will describe symptoms. We can follow the CARS score, which is the Childhood Autism Rating Scale, things like that. But one of the limitations, exactly what you're saying, the limitations is that we don't even have a unified way of measuring what autism is, right? It's a spectrum that doesn't really even have a cause that we know yet. And so that is one limitation. What we would have to probably do is focus more on behavior or symptoms that we're trying to modify and move from there into a clinical trial, and then eventually evolve into, well, when your child has this behavioral change, this is the protocol for it, or this is how we attenuate it. MeRT is a little different in a sense also, even a variation to that, in the sense that we're not really treating a brain disorder. We're treating what we see on the EEG. In other words, we're re-attenuating the abnormalities we see regardless of what the diagnosis is. And so it's a unique type of treatment approach.